It's time again for another edition of Sports Insider, brought to you by Faith Regional Health Services. I'm News Channel Nebraska's Chris Whitney, and it's a pleasure to have with us again Russ Baumert, physical therapist with Faith Regional Rehabilitation Therapies. Thanks for joining us, Russ.
Thanks for having me again.
Well, topic today, we're talking about patellofemoral pain. It's a common knee diagnosis in athletes, laborers, active people, really. What is patellofemoral pain syndrome?
Patellofemoral pain is classically described as a tracking issue in our kneecap. It can be somewhat irritating to severely debilitating pain during activities such as you spoke before, jumping, cutting, running, things like that.
Absolutely. So patellofemoral pain, what are the typical symptoms that go along with that?
Most of the time we see patellofemoral symptoms in the inside of the knee or on the front of the knee, going up and down stairs, jumping, squatting, running, cutting. I often hear people when they sit for a long time, when they get up, their knees ache.
Absolutely. What is the best kind of way to treat PFPS then?
Well, traditionally, again, treating the symptoms, icing it, resting it, activity modification. There are braces out there. Those treat the symptoms. The underlying problem a lot of times is muscle imbalance across the hip. And so if you come to physical therapy with a diagnosis like this, we work the hip symptoms or work the hip muscles, and usually we get a pretty good response on the problem and the symptoms go away.
Absolutely, and again, that strength kind of takes time to build. About how long does it kind of take to look at that? It's a process that takes a few weeks, certainly.
To develop the strength in those muscles, you're looking at 6 to 8 weeks. With patellofemoral symptoms, this isn't a diagnosis that comes on as a result of trauma. It is a gradual onset, and so usually the treatment is gradual as well.
If somebody's got patellofemoral symptoms, who are they looking to contact? Who should they get a hold of at your office?
Well, they should first start at their family doctor, discuss with their family doctor their symptoms, and then their doctor can discuss some of their options, one of them being physical therapy to help treat or manage these type of presentation.
Absolutely. Well, Russ Baumert, physical therapist with Faith Regional Rehabilitation Therapies, thanks again for joining us. It was a pleasure to have you.
Thank you very much.
This has been another edition of Sports Insider, brought to you by Faith Regional Health Services.